Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Estrogen. Natural estrogen is C18. Forms of natural estrogen include E1 is estrone, E2 estradiol, E3 estriol, E4 estetriol. The most common estrogen in reproductive age group is E2. Most common estrogen in menopause is E1. Most common estrogen in pregnancy is E2. Most specific estrogen in pregnancy is E3. Ratio of E2 is to E1 equals to 2 is to 1 in polycystic ovarian disease. Normally the ratio of E2 to E1 is 2 is to 1. But in polycystic ovarian disease, the ratio is reversed. If you see the potency, E2 is more potent than E1, then E1 is more potent than E3, followed by E4. Sources of estrogen include granulosa cells, theca cells, corpus luteum, and placenta. These will use fetal dihydroxyepiandrosterone sulfate. So estrogen will bind to sex hormone binding globulin mainly. It also binds to and free albumin. Sex hormone binding globulin increases by estrogen, whereas sex hormone binding globulin decreases by androgen, insulin, progesterone, growth hormone, and cortisol. Estrogen can be given as three pills: high dose pill, low dose pill, and very low dose pill. High dose pill High dose pill is if estrogen is more than or equal to 50 micrograms, then it is high dose pill. If estrogen is less than 50 micrograms, then it is low dose pill. If estrogen is less than 20 micrograms, then it is very low dose pill.
thank you and thank you for watching.